Unasyn Vial is a combination medication that is used to treat a wide variety of bacterial infections. It is a penicillin-type antibiotic, which means it works by stopping the growth of bacteria. It is important to take this medication exactly as prescribed by your doctor. The dosage and timing will depend on the specific type of infection you have. Be sure to follow your doctor's instructions carefully to get the most benefit from this medication. When using Unasyn Vial, it is important to follow your doctor's instructions. This medication is given by injection into a vein, usually every 6 hours. The dosage is based on your medical condition and response to treatment, and for children, it is also based on weight. If you are administering this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. It's important to store and discard medical supplies safely. It's important not to mix aminoglycosides, such as gentamicin, together with this medication in the same fluid. For the best effect, use this antibiotic at evenly spaced times and try to use it at the same times every day to help you remember. Even if your symptoms disappear after a few days, continue to use this medication until the full prescribed amount is finished. Stopping the medication too early may result in a return of the infection. Be sure to inform your doctor if your condition lasts or gets worse. Some common side effects of Unasyn Vial include nausea, vomiting, diarrhea, and pain at the injection site. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience chest pain, difficult urination, easy bruising, signs of liver disease, new signs of infection, or severe diarrhea. In rare cases, this medication may cause a severe intestinal condition. If you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool, contact your doctor immediately. Avoid using antidiarrhea or opioid products as they may make symptoms worse. Prolonged or repeated use of Unasyn Vial may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or difficulty breathing. Additionally, if you develop any rash, seek medical help right away. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. Before using Unasyn Vial, it's important to talk to your doctor or pharmacist if you have any allergies to penicillin or cephalosporin antibiotics, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have viral infections, kidney disease, or liver disease. If you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, make sure to consult your doctor or pharmacist, as this medication contains sodium. It's important to note that this medication may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using Unasyn Vial before having any immunizations or vaccinations. For older adults, there may be a greater risk for side effects while using this drug, so it's important to be cautious. If you are pregnant, this medication should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Unasyn Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Unasyn Vial include aminoglycosides, such as gentamicin, blood thinners, such as warfarin, methotrexate, and tetracyclines. It's also important to note that Unasyn Vial may interfere with certain lab tests, such as certain urine glucose tests, which could potentially cause false test results. Be sure to inform lab personnel and all your doctors that you are using this drug. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. They will be able to provide you with the most accurate information based on your specific medical needs. If someone has taken too much Unasyn Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include seizures. It's important to seek help right away in case of an overdose. Your doctor may perform lab or medical tests, such as checking kidney function and complete blood count, while you are using Unasyn Vial. It is important to attend all medical and lab appointments as advised by your doctor. Make sure to take each dose of Unasyn Vial as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. Always keep medications out of reach of children and pets. Do not dispose of Unasyn Vial by flushing it down the toilet or pouring it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.